people have no idea that I'm close to 73. Some people want to see, they guess that they want to see my driver's license, which is very, very complimentary. Well, I had a very, very deep scar that was put there by a previous plastic surgeon who, if you had a copy of the picture, you would see about a 6 to 7 inch scar right here along my forehead. He did that while giving me an eye lift, as I recall. I had it about at least 3 or 4 years. It was very deeply embedded. And now you can see maybe a crease in my forehead, but you don't see the scar.
You had a scar that was pretty deep. I mean, it looked almost like a wrinkle, but it was even more than a typical wrinkle, and it went pretty much across the forehead. So, and then on top of that, he had some pretty deep lines through what we call the glabella. So the nice thing was, because of where the scar was, it allowed me to both improve the scar, and at the same time, I was actually able to work on some of the muscles that create the deep furrows between the eyebrows. And in doing so, this whole area looks much smoother than it normally would. That's the area that a lot of people will treat with Botox, but because of the existing scar, I was able to actually work on the muscles directly, which is like having permanent Botox. So we made this part of the forehead look smoother, and we really helped diminish, almost get rid of the scar. So between the improvement in the scar and those deep lines, it just made his forehead just look a lot more relaxed and serene, and not like he had some trauma there. So it's been, I think, one of the highlights for you, right?
It's made a tremendous difference because your eyes, older people get their eyes sunken in, and the fat transfer brings them out. And I wasn't even aware that anything like that was available. You get a feeling of the confidence that Dr. Dahiya has in his abilities, and he just does, he recommends what will work for you. But he's like an artist. He does an excellent job.